You're watching CTOM TV. Knowledge is power.
Christine sent a question in. She says, I want to ask my oncologist about precision oncology, but I'm worried that she'll think I don't trust her. What should I do?
Well, that's an interesting question. I have heard that question before, or that comment that patients are worried about offending their oncologist. But from my experience, I think oncologists really want to get in on precision oncology. I think a lot of oncologists feel they have their hands tied right now, and that they're not provided with the tools they would like to. They have to apply for certain things like PET CTs. And I mean, I hear of oncologists, getting turned down for PET CTs 5 out of 10 times. Mm-hmm. So they definitely want the tools. Mm-hmm. I think when you do ask your oncologist about precision oncology, I think the biggest, the biggest problem you're gonna run into there is that they just don't have these tools. So if you offer to supply them out of pocket, I think most oncologists would be very open to that.
That's been our experience, hasn't it?
It has, yes.
And is it really, with exceptionally rare exceptions, when you take it upon yourself to get the data about what's actually happening in your body, what's gone sideways, what's happening with your DNA that's causing those cells to replicate and give you whatever type of cancer that you have, and then gather some information like the kind Alex and his team get about what treatments are going to be best for you. The vast majority of the time, oncologists are grateful.
Yeah, I mean, providing, you present them with the data that shows how beneficial these specific treatments are on a precision based level.
That's right. Yeah.
And they're usually all for it.
It's true. And that is why you might be feeling kind of your spidey sense might be tingling about my doctor might not be pro this precision oncology thing. It isn't that your doctor wouldn't support precision oncology. It's that they couldn't get it for you. Yeah. But also, you see, as Alex was saying, until you've presented your doctor with the peer-reviewed medical journal data about what treatments are going to be best for you, a lot of doctors have a very healthy and natural skepticism on your behalf when you start talking about going outside public healthcare or kind of doing your own thing or looking for your own solutions, because they're far more accustomed to patients going to alternative treatments as opposed to just newer treatments that they aren't aware of or can't get a hold of. So there's a natural skepticism on your behalf that oncologists will have. But if you can reassure them you're going to use FDA-approved tests and you're only going to give them information about FDA-approved treatments that they could access for you, I can't imagine that your oncologist would be resistant.
Yeah. Now, I do get, one of the common things that I do hear from patients is they said, well, my doctor said that this is the best and there isn't any targeted therapies. And, there isn't any inherited mutations or, they haven't heard that sequencing is going to be beneficial. So they will make these statements based on their own individual knowledge. But you have to understand there's a lot going on and there's no way your doctor's going to know about what everyone is doing. Mm-hmm. That's our job.
Mm-hmm. And I mean, really, in 10 years, how often has it been the case when you've had genetic testing done for a patient and it hasn't given you additional treatment options?
Well, it doesn't really happen very much.
Yeah. So if your doctor is saying you won't get any more options or we're giving you the most current care and you haven't had genetic testing,
that's a huge assumption.
It's almost certainly not entirely accurate. Exactly. Again, they might be well intended and they may simply not know the value of genetic testing, but the reality is it's exceptionally beneficial and it almost always provides additional treatment options that prolong your survival and really reduce your side effects. So good question, Christine. I hope we didn't go on too long about that, but I really want you to feel reassured to take care of yourself. Your doctor's feelings are not your concern. No. Making sure you're getting the right treatment is.
Thank you for watching CTOM TV. Subscribe below and stay informed.